How many patients with myeloma do you see?
So I can tell you, just as a group, we see over 400 new cases referred to us a year. And you're right, there's absolutely data saying that the number of cases of myeloma center sees is correlated with survival. And this is myeloma is a rare disease. I specialize in one disease, so I'm lucky. I get to just do one thing that I love all day, every day. And you're right, having someone who just does that one thing. I guess it's like going to your orthopedic surgeon who just wants the knee guy, right?
That's
you don't want him doing your shoulder.
That's right. I look at the treatment that you gave me was at least 3 years ahead of the standard of care. Because when I was looking for a doctor, I said, I want somebody that's going to give me the standard of care, give me the FDA-approved drugs, widely studied, widely used in the community. And I realized that wasn't enough. I wanted somebody that was creating the standard of care, and that's what you do at City of Hope. And the example I tell friends about is that when a patient is diagnosed with myeloma, they usually, at the time when I was diagnosed, were getting 2 or 3 different drugs in various combinations. You quickly said, I don't want to use those standard 3, we're going to change one of those out, and then within 1 month you added a 4th drug, a monoclonal antibody, that you had been one of those pioneers in those studies, and you said we're going to go with quad therapy, and you did that 3 years ago. And then at ASH, at the American Society of Hematology, what was the conversation like this year? It's all about, well, we should be doing quad therapy, but you were doing it 3 years ahead of what was common. So I'm playing beat the clock, I think, in trying to make sure that I'm staying ahead of the science, and that's what I get from you.
I think that's part of our mission, is really we don't want to be sort of status quo. We're really there to move the field forward.
Right.
And that's sort of our mission, and we have great scientists as part of our myeloma program.
You do.
Myeloma is different in every patient.
Right.
And to try and firstly individualize that, but also understand why does it respond, why does it come back.
And I loved that just recently in our most recent clinical visit, we had changed things up based on breaking science and my specific genetics. And I don't think that would be commonly available to people in the community, that level of expertise and that level of specificity.
I think what you've seen on campus is really that a unique part of us is that we work with scientists and in people literally from the lab making something and then allowing us to use that to treat patients. And every Friday we have a meeting with scientists across campus. They present their concepts. We present some of the updates in the field, and we all work together. When we work sort of hand in hand, is really, move things ahead dramatically.
I love that bench to bedside concept, and you have to be connected with somebody that's on the cutting edge, kind of like access to the future. Because I talk to patients around the country and I hear about their specific case and what their treatment plan is, and sounds like I'm talking to somebody that's getting their care 5 years ago. And I'm just encouraging those people that you need to find an expert because you need to stay ahead of the curve. You need to get access to some of this breaking science. And so you can put that plan together that's going to improve your survival and quality of life.
I think that's what's special about City of Hope. We're actually known now as a center that can open studies quickly. We accrue incredibly quickly, which tells you just the unmet need for studies. So, that's exciting. And you're right, we're going to do research down in Irvine now. I'm very excited about that.
So incredible. I love being in this building today in Irvine because at some point it will be possible that we'll be in this exact building here in Irvine, and you'll walk in with my labs, most recent labs, and you're going to say, Todd, you're cured. I'm absolutely convinced of it. I can see it, I believe it, and I know it because of the science that you and your colleagues are working on. It's so exciting.